Hey guys, Dr. Whitney Bowe here. This video is all about filler reactions and the COVID-19 vaccine. So for those of you who don't know me, I am Dr. Whitney Bowe. I'm a board certified dermatologist based in New York. I'm considered an expert injector. I'm very comfortable and familiar with all the different types of injectables and how to treat any kind of adverse reactions or side effects. So I did an IGTV video a while back when we first heard about these swelling reactions that were relating and associating hyaluronic acid filler injections to the COVID vaccine. Now, since then we've learned a lot, so I made this video to give you guys an update, let you know the information that we have right now, and I actually collected a bunch of you sent in questions, so I wanted to just power through those questions and make sure to answer the questions that you guys have. So first of all, a caveat before I jump in, this is by no means an endorsement. I'm not saying to people you have to get a vaccine. I think this is a very personal decision for everyone. Me personally, I'm always weighing risks and benefits for my patients, and I weighed them for myself. When I got my first dose of the vaccine, I got the Moderna vaccine. I'm eagerly awaiting my second dose. I do think that this is one of those things that the risk-benefit ratio for everyone is going to be different. First of all, a lot of people were asking me, like, what's happening here? Is this the same thing as when we get swelling after we actually get hyaluronic acid filler injections? My sister had her lips injected and she got swollen right afterwards. How is this different? So what we're talking about here is we're talking about a delayed hypersensitivity response, meaning this is a swelling reaction that occurs where you were injected with hyaluronic acid filler in somebody who was injected even months before. So say that you went into your doctor, you got, your tear troughs, your under eyes injected with a little bit of, Restylane or Belotero, and at that same visit, maybe you got your lips injected with a little bit of Volbella, or Juvederm. You had that procedure done. We all have a little bit of swelling in that area afterwards. That's very normal for patients to experience, 24, 48 hours after you get filler injections. That all went away. You're doing fine. You're going about your business. It's months later. You have the opportunity to get the COVID-19 vaccine. It's something that resonates with you. You feel like weighing your risks and benefits. You really want to get the vaccine. You go and you get the vaccine. Within 24 to 48 hours later, you suddenly notice that those areas that you had injected months ago, the under eye area, the lip area, are suddenly swollen, okay? That's what we're talking about here. It's called a delayed hypersensitivity reaction. So what's happening? So when you get the vaccine, your body's having an immune reaction to it, right? That's the point. The whole point of getting the vaccine is to generate antibodies and get that immune response so that you can end up being protected if you're exposed to the actual virus in the future, right? So we want that type of response. Now, during that sort of immediate post-vaccine period, we have some of these immunologic reactions, right? So we have different types of responses. Some people get a local swelling, they get a local redness, tenderness at the injection site. If you have had hyaluronic acid filler injections, there is a very small risk, we're talking about a tiny risk, that you will also have swelling in the area where you had those injections. That is a delayed hypersensitivity reaction to that filler. That is very different and needs to be differentiated from an anaphylactic reaction, right? So if you get the vaccine and you develop shortness of breath, you're getting hives, that's a 911 emergency room situation. That's not what I'm talking about here. What I'm talking about here is, Dr. So-and-so, you injected my lips a couple months ago and my lips are really swollen and I just got the vaccine 2 days ago, or I just got the vaccine this morning. No shortness of breath. I'm feeling okay. No other symptoms, but my lips are pretty swollen. That's what we're talking about here. Okay, so it's a localized swelling response to the filler. Now, why is it happening? Why are you suddenly getting swelling in an area that was injected months ago and has caused no problems, since that time? It's part of that immune reaction to the vaccine. So your immune system is revved up, right? You got the vaccine and your immune system is supposed to be, that's the whole point, is now sort of on fire. It's revved up. And it's sort of like, okay, wait, what's going on? What's going on? I'm here and I'm ready and I'm supposed to be responding to this new antigen, this new, exposure that now I'm dealing with. Wait a second, what's that in your lips? I kind of saw it before, but I wasn't really paying attention. Now I'm going to react to it. Okay, so that's what's happening. This type of reaction is incredibly rare. So just to put it in perspective, of the very few people who have reported this reaction, there are many, 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 many more people who have had hyaluronic acid fillers, had the COVID vaccine, and had no reaction whatsoever. This is not new. We've definitely seen this before. So dermatologists who are expert injectors, who are trained on all the side effects of filler injections, we know very well that this can happen in certain scenarios. We've seen this before with the flu vaccine. We've seen this with the shingles vaccine. We've seen this with people who got the flu, who actually had a viral infection. This is not a new phenomenon that we don't know how to deal with and we don't understand it and we've never seen it before. We see it, we understand it, we know it, we recognize it. It's just that it's extremely rare. So it's just something we probably haven't spoken about as often as maybe we should. So it's a really, really rare side effect that can happen. And it's happened over the years to many of us. So I got a question. If I have fillers, does that mean I can't get the vaccine? No. So it's not a contraindication. So just because you've had fillers does not mean that you can't get the vaccine. And as I said before, it's incredibly rare that you're going to actually have this swelling reaction. Does this happen with Botox or Dysport? So no. So up until this point, we have not seen this happen with botulinum toxins, with neuromodulators, Botox, Dysport, or Xeomin. Those injections are also given with a needle, with a syringe, right? But they're very different because they're very transient. It's not like there's a substance that is persisting in your tissue, in your skin for a long period of time, the way that we see with fillers. So up until this point, we have not seen any of these types of reactions to Botox, Dysport, either with the COVID vaccine or with any other vaccines or flu-like illnesses. Okay, is it only particular fillers or can this happen with any filler? So the ones that have been reported in the Moderna clinical trials were with hyaluronic acid fillers. So those are things like Juvederm, Restylane, Volbella, Belotero, hyaluronic acid injections. In the vaccine trials, we did not see any reactions to, say, Radiesse, which is calcium hydroxylapatite. We did not see any reaction to Sculptra, which is polylactic acid. Is it theoretically possible that those could maybe cause a reaction as well? It's possible. Looking back at, again, our other experiences with flu vaccines and viral illnesses and seeing this type of delayed hypersensitivity reaction and localized swelling, much more common with hyaluronic acid fillers. Is this happening with both the Pfizer and the Moderna vaccine? So yes, it is. So in the clinical trials, it was reported with the Moderna vaccine. It was not reported with the Pfizer vaccine, but anecdotally speaking to my colleagues, they are seeing it with both. So, and we expect it to be with both. It's probably going to happen with all types of vaccines. We've seen this before with other vaccines. So I wouldn't be surprised if it happens with every vaccine, but again, in a very, very, very small percentage of people. If this happens to me, what do I do? Okay, so if you get a localized swelling reaction, first thing is, are you having difficulty breathing? Is this more than just a localized filler reaction? If it is, obviously call 911. If it's just localized swelling in the area where you were injected, what should you do? First step is to first of all, call your dermatologist, call the person who injected you, right? If you can't reach them, take Benadryl. So antihistamines. So, antihistamines are gonna help to decrease that inflammatory response. And it's really not gonna be an issue when it comes to dulling or blunting your immune response from the vaccine. The next thing, and again, like this should all be done with the treating physician being alerted and playing a role in this. So this is what I'm thinking and anticipating that most doctors will end up doing, but each case is very specific. So of course you want to be talking to the person who did your particular injections and knows your medical history, knows what other medications you're taking. But say after, a couple of days, say you're taking the Benadryl, and say you're taking like Allegra or Zyrtec in the morning because you don't want to be tired, and then you're taking Benadryl at night, and you're, oh gosh, I'm still swollen. I'm still really swollen. What do I do? Chances are your dermatologist is going to give you a short course of oral steroids, prednisone, Medrol dose pack. Do we think that that short course of oral steroids is going to blunt or dull your immune response to the vaccine? The general consensus is no. We think that the dose is low enough, short-term enough, shouldn't have a long-term impact. Do we know with 100% certainty? No. So I wouldn't jump to try to take steroids right away if you don't have to. Okay, what else can you do? So what if it's not going away? So all the cases that we've seen, they have been transient, couple of days, gone, everybody's fine, right? No big deal. But what if it doesn't go away? There's gonna be a scenario, there's gonna be somebody out there, who is still swollen after a week, and they're like, oh my gosh, I did Benadryl, I took prednisone, this is still swollen, what do I do? At that point, your doctor may use an enzyme called hyaluronidase, inject it into the area where you had the filler to break down the filler. So that is certainly a wonderful last resort, that we have this enzyme in our back pocket and can use it if we really need it, right? If this happens and I still need to get my second dose, what do I do? Okay, so that's a great question. So say you're one of these like very, very few people who get this reaction and they say, oh no, I still have my second dose, and what if it gets even worse, during my second dose, what should I do? So one thing to do is to consider prophylactically treating with Benadryl. So unlike, say, prednisone or, ibuprofen, there's no theoretical risk that the Benadryl is going to blunt your immune response to the vaccine that we know of. I would feel very comfortable recommending to somebody, if it was my patient, if they had gotten a localized swelling reaction the first time after the vaccine, they were due for the booster shot 3 or 4 weeks later, I would feel comfortable saying maybe take some Benadryl before. If I'm scheduled for filler, is there a certain type of filler I should ask for to minimize the risk? So, I think that there might be a reason to choose something like Sculptra over hyaluronic acid fillers. I think also the location of the filler. So if you're thinking about getting filler in a deep location like the cheekbone, I think that's a lower risk of causing this reaction as something more superficial like in the tear trough or in the lip area. So it might have to do with the depth of injection. And the cases that we do see these side effects, they seem to be in areas that don't have the same depth. And when you inject the cheekbone area, you're injecting deeper. Sculptra in general is injected deeper. So maybe that's another reason why we're not seeing that as much with Sculptra, as we are with the hyaluronic acid fillers. Blending your hyaluronic acid fillers, to me, is another way of minimizing the risk of having these reactions, because you're sort of breaking down those very highly cross-linked hyaluronic acid, depots. It's going to be less immunogenic to your body. You also want to not inject a large bolus in one place. So as an injector, one of my favorite techniques is to put little tiny droplets, in multiple locations, as opposed to one large bolus, one large ball of filler. Again, if you're going to have a reaction to something, it's going to be more robust if you have one big, ball of that product. So if you're an injector, and you tend to inject that way, first of all, I think it looks more natural if you inject in multiple sort of small aliquots, but for many reasons, including this one now, to try to minimize that kind of risk of swelling in these delayed hypersensitivity reactions, I would say maybe try to minimize the amount that you're injecting in one specific location. All right, guys, I really hope that you found this video helpful. Just by no means am I encouraging people to get the vaccine if they're not comfortable with it. Of course, I got my first dose. I'm eagerly awaiting my second dose. But, I think for everyone, this is such a personal decision. You have to weigh the risks and benefits. So, you have to make the decision that's right for you. But I also don't want people to be fearful if they've had filler and they're worried like, oh my gosh, should I not get the vaccine because of the filler? I hope this, just going through, some of this information, put your mind at ease. And good luck, everybody. Stay healthy. All right, if you have any other questions, list them below and I'll try to get to them.